I would say navigating the constant changes. I like to say the only thing that is certain about healthcare is that it's constantly changing. I would say strong leadership characterized by clear communication. And also, it wasn't on the list, but an ability to be wrong. And it's not the end of the world if you make a mistake. I often said that one of the main things that I have learned working in healthcare is how to say, I don't know.
How do you specifically see these impacting hospital workflows? Is your team implementing anything, or are you seeing the rise in it?
Sometimes AI hallucinates. They put a lot in there that shouldn't go in there. We haven't seen a big problem with that where I'm at. There's always going to be some error in it, but we do review it, make sure that it's accurate. It's people that we're taking care of. That the computers are an assistive. The technology is assistive, not...
Hello, everyone. Welcome back to the BetterHealthTech Podcast, where we explore how technology is shaping the future of healthcare while keeping the human element at the center. I'm Shelby Soto, a marketing and technology professional with over 15 years of experience leading digital growth and product innovation. I worked with national corporations and major media companies, bringing together digital marketing, automation, project strategy, and go-to-market execution to drive real impact. And today, I'm excited. We have a very special guest with us. Joining us is Christina Christy, an accomplished health information manager with over 8 years of experience in hospital operations, team leadership, and healthcare data management. She holds an MBA in healthcare management and multiple certifications, including RHIA, CPCS, and CRCR. Christina, welcome to the show. It's so great to have you here. Before we get started, would you mind sharing a little bit about your journey and your background into healthcare and what led you to specialize in health information management?
So I started out as a medical transcriptionist. It was a job that would allow me to stay home with a young child. I enjoyed it. It was fairly easy, actually, because I was already typing and everything. So I could kind of start seeing the wave of the future with medical transcription. It was not going to last. I know that it's still out there, but less and less now that AI is taking over a lot of the documentation. So I decided to go to WGU to get my bachelor's degree in HIM. I was almost finished with the degree when my husband lost his job and we needed health insurance. So I found an HIM tech position, took that position while I finished my degree. Within the year, my manager left, and I had earned my degree by then, got my RHIA certification, and took her position over 3 hospitals, which it's not as large as that sounds. There's 4 people under me, but it was spread out across the network. From there, I got my master's degree in healthcare administration, the CRCR, CPCS, because I was also over credentialing at that hospital. And now I'm director. It's been like 6 years.
That's amazing. Your journey sounds amazing. So you've managed teams across multiple hospitals. What are the biggest operational challenges you see today in healthcare systems?
From a leadership standpoint, with all of the remote workers, making sure that your team still feels like part of the team whenever maybe they're not in the office with everyone else would be the biggest operational problem within the departments. Within healthcare system sense, I would say navigating the constant changes. I like to say the only thing that is certain about healthcare is that it's constantly changing. Rules and regulations, payer changes. I would say that would be from a healthcare systems standpoint.
Yeah, that makes a lot of sense. So, from managing teams across hospitals, what really defines a high performing healthcare team to you? And is it more about strong leadership, clear communication, structured process, or the right use of technology? I know that was kind of a lot in one question, but what really defines a high performing healthcare team, in your opinion?
I would say strong leadership characterized by clear communication. And also, it wasn't on the list, but an ability to be wrong from a leadership standpoint. You have to be willing to let your team see you fail so that they know that failure is an option. And it's not the end of the world if you make a mistake. I've often said that one of the main things that I have learned working in healthcare is how to say, I don't know, but I will find out, or I will try to find out.
That's great. That is, you don't hear a lot of leaders saying that. So I think that's amazing. And that's the human side. So health information management sits at the intersection of data and care. How important is accurate data in improving healthcare delivery to you? How important is that?
Documentation and data follows you throughout your healthcare journey. From the very beginning, now especially, you could have birth records that will follow you into adulthood all the way through end of life. And if there is something incorrect in your documentation, that's going to follow you from doctor to doctor to doctor across healthcare systems. And a lot of times information gets copied and pasted into the next document and into the next document. And if you're not aware of what's in your record, it can lead to inaccurate healthcare. It's just absolutely vital that the data is correct.
Yeah, I can definitely see that. So when we started, you had mentioned, you saw AI and how you knew that a lot of things were going to change. So now that it's here, it's full force right now. And so we're seeing the rise in AI tools like automated documentation, AI scribes. How do you specifically see these impacting hospital workflows? Is your team implementing anything, or are you seeing the rise in it? In your day to day?
We have a small team of medical transcriptionists still at our hospital, and their workflows are reducing as the AI scribes and automated documentation increases. They all do a fantastic job. But the AI scribes, it becomes even more important for doctors to be aware of what they're signing, because there's not a human element to review it beyond them. I think that some physicians, because of that, are hesitant to adopt it. There's a little bit of fear of inaccuracy. Sometimes AI hallucinates. They put a lot in there that shouldn't go in there. We haven't seen a big problem with that where I'm at. There's always going to be some error in it, but we do review it, make sure that it's accurate, let the doctors know if they need to change something. But it is going to impact hospital workflows in that some jobs, while not eliminated, will change. It becomes more of an overview than a actual process of you doing the work yourself.
Yeah. And so you kind of answered my next question, which was, do you think organizations are ready to adopt these technologies, or is there still resistance? And you mentioned physicians might be a little bit more resistant because they are ultimately responsible to check that work and the AI. So is there any other resistance or reason why you think that people are slow to adopt? Or
well, I don't think people are slow to adopt. I think they're going to forge ahead and just it's going to keep increasing. From a leadership standpoint, from the organizational standpoint, it's very attractive. There's a lot of cost savings in using the new technologies. I think they're going to power through the resistance. And I have seen studies where physicians, when asked, they can see pitfalls with it, but on the whole, they're willing to try. Even in, I think I listened to, I can't remember the person's name, but he had a talk on rural hospitals and the adoption of AI. And while a lot of the physicians were hesitant, they were willing. I just think that it's going to take oversight. They're going to have to watch to be careful that what's put in the documentation is accurate.
Yeah, makes sense. It's going to be interesting. I feel like there's going to be another, and this is just my opinion, another, maybe more, even another job instead of people losing jobs. There might be another level of, the human. We always need the human side of things to double check that. So it's very interesting. Well, you hold RHIA, CPCS, and CRCR certifications. How do these contribute to improving healthcare systems?
Show a willingness to learn more. I'm not really so much into the certifications. I think that pretty much anyone can be taught a position if they have a willingness to learn it. But when I'm looking for new staff members, I'm not necessarily looking for them to be certified. I'm looking for an attitude, a willingness to learn. I got the certifications because I like to continuously learn new things, and it's just a natural progression. I'm constantly looking for new things that I can better myself with. I'm kind of a late bloomer. I didn't do this like right out of high school. I didn't decide. I'm still not 100% sure what I want to be when I grow up, but I think that they improve healthcare systems just because it shows a willingness to learn more, to make sure that you stay up on current regulations, rules that, like I said, are always changing.
I think that's great. One of my mottos is a forever student. So we've had, guests on here too, that they seem to be all aligned. Everyone is, wants to constantly learn. And I think that is amazing. So what do I want to be when I grow up as well? I love that. So with all the focus on technology, in your opinion, how do we ensure healthcare remains human-centered? You seem to have a very, what would I call it, human-centered approach to, your leadership, to everything that you do. So with all of the focus on technology right now, in your opinion, how do we ensure healthcare remains human-centered?
I think mostly we just have to remember that it's people that we're taking care of, that the computers are an assistive, the technology is assistive, not, the technology isn't what's giving the care, the people are what's giving the care. And we just have to remember, it's probably just a case of remembering that it's the employees are important, that the patients are important, that the technology is just to assist you in making sure that the care that you give to both your staff and to your patients is accurate, and you have to use it. You have to use it as a tool instead of it becoming the center.
Yeah, that's great. So looking ahead, are there any innovations in healthcare that excite you the most? Any, technology, just really any innovation that you are, excited to either learn more about or hear more about, or that other people are implementing?
Unfortunately, not really. I find the AI fascinating. I think eventually it'll probably be a great thing. I guess I'm probably one of the ones that are a little hesitant. I'm a little afraid of the error rate that it might cause if the oversight's not there.
Okay, that makes sense. So what advice would you give, I guess, from that perspective to healthcare organizations trying to modernize their systems?
To make sure that they stay people focused and not systems focused. You can be penny wise and cash poor, I guess, but it's just, you have to make sure that you're not so focused on the technology that you lose sight of the people that have been sometimes with you for 20, 30 years who are nervous themselves. Like one of the things that I think people need to be aware of is rapid change is scary for people who are on the front lines. So you might want to step back and slow down a little bit, keeping in mind that these people are worried about their livelihoods, and you can end up saving money in the short term and then losing dedicated people because they're just worried that you're not going to have space for them.
That's great. Okay, so this is kind of our last wrap up before we end. We do a round called Rapid Fire. I'm going to ask you a few questions, and no overthinking, just quick answers. It could be yes, no, I don't know, whatever it is. But just have a little bit of fun, and we go from there. So. First question, one technology every hospital should adopt.
EHRs, if they don't have them yet.
That's good. Biggest mistake healthcare organizations make?
I don't know.
AI in healthcare, is opportunity or risk?
Both.
One skill every healthcare leader should have?
People care.
One process in healthcare that needs urgent improvement?
Documentation.
That was good. What will healthcare look like in the next 5 years to you?
It's going to be a lot of telehealth.
That's all great. Well, Christina, this has been a really insightful conversation. Thank you so much for sharing your experience and your perspective with us. And before we wrap up, is there a place where people can connect with you? Maybe your LinkedIn, any kind of social medias?
LinkedIn would probably make sense.
Okay, great. So thank you everyone for tuning in to another episode of BetterHealthTech Podcast. If you enjoyed this episode, don't forget to follow us on YouTube, Spotify for more conversations at the intersection of healthcare and technology. See you in the next episode.